الحمد لله رب العالمين والصلاة والسلام على أشرف المرسلين وعلى آله وصحبه أجمعين. Hand washing and personal protective equipment by Professor Mahmoud Hani Sulaiman. We are still inside infection control. Wash and dry hands after touching blood, body fluids, secretions, excretions, and contaminated items or equipment or instrument, regardless of whether gloves are worn or not. Wash and dry hands immediately after gloves removed, after significant patient contact, as contact with or after physical examination, emptying drainage bags, undertaking venipuncture or delivery of an injection or going to toilet to be continued. Personal protective equipment, PPE. The use of PPE protects healthcare workers and others from exposure to blood and body fluids or substances. PPE that complies with relevant standards should be readily available and accessible in all healthcare services. Gloves. Wear gloves. Clean, non-sterile gloves are adequate. When touching blood, body fluids, secretions, excretions, and contaminated items, put on clean gloves just before touching mucous membrane and non-intact skin. Sterile gloves are required for invasive procedures. Change gloves between tasks and procedures on same patient after contact with material that may contain a high concentration of microorganisms. Remove gloves promptly after use before touching non-contaminated items and environmental services and before going to another patient. Dispose of gloves in clinical waste or place in plastic bag and tie before disposing it in general household waste. Wash and dry hands immediately after removing gloves to avoid transfer of microorganisms to other patients or environments. Gowns. Wear gown to protect skin and prevent soiling of clothing in procedures and patient care activity that are likely to generate splashing or sprays of blood, body fluids, secretions, or excretion, leading to soiling of clothes. Select a gown, long or short sleeved, appropriate for activity and the amount of fluid likely to be encountered. Remove used gown as promptly as possible. Using gloved hands, roll up carefully, place in a linen receptacle for laundering. Wash and dry hands to avoid transfer of microorganisms to other patients and environment. Masks, eye protection, face shields. Wear a mask and eye protection or a face shield to protect mucous membranes of eyes, nose, and mouth during procedures and patient care activity that likely to generate splashes or sprays of blood, body fluids, secretions, and excretions during cleaning activities. Remove mask by holding ties only and dispose of mask into a clinical waste bin. Reusable face shields or goggles removed carefully and placed in a receptacle for cleaning. Waterproof aprons. Wear waterproof aprons when splashes or sprays of blood or body fluid substances are likely as during cleaning activities. Remove the used apron as promptly as possible using gloved hands, roll up carefully and place in a clinical waste bin. Environmental control. Ensure that health service has adequate written protocols for procedures for routine care, cleaning, and disinfection of environmental surfaces, beds, bed rails, bedside equipment, and other frequently touched surfaces. These procedures are being followed. وفي النهاية لا أجد إلا أن أقول لكم thank you والحمد لله رب العالمين.